Pain is a signal, not something to ignore. If your joint is sore, swollen, or moving differently, get assessed early. Osteoarthritis often begins subtly. You may notice stiffness after rest, joint clicking, mild swelling, or dull ache during a movement. These early symptoms reflect changes in how your joint functions long before damage appears on scans. They relate to how low is distributed physics, how joint fluids changes chemistry, and how your tissues begin to respond, biology. Early recognitions give us the time to apply regenerative strategies and preserve your joint before irreversible changes set in. Staying active isn't enough. It must be the right kind of activity. Repetitive running or lightweight training may improve cardiovascular fitness, but it can wear down your joint if not structured properly. The goal is to load muscle, not grind away the cartilage. We focus on building muscle strength, mechanical stress, and recovery, which protects the joint, improve alignment. Cardiovascular fitness and muscle-centric fitness are not interchangeable. Motion capture systems like MAI motions help us to identify harmful patterns and describe training that preserves joint health. Prevention works best when guided by an understanding of physics, chemistry, biology, and most importantly, timing. Regeneration isn't random. It requires structure. Focus on resistance-based movement that strengthen muscles around the joint without loading the cartilage. Pair this with anti-inflammatory diet rich in omega-3s and collagen-supportive nutrients. Supplements like chondroitin can support joint chemistry and cartilage health when used appropriately. Importantly, high-dose vitamin C has been linked to support collagen synthesis, activating regenerative pathway, including stem cells activity. This can be taken orally or via intravenously in a clinical setting. It optimizes our biological readiness for treatment. Vitamin B12 also play an important role in our nerve health, red blood cell production, and cellular regeneration. Ensuring optimal level of these nutrients enhance our body ability to respond to regenerative therapy. But regeneration also depends on quality of sleep, stress reduction, and hormonal balance, all key in setting the biological stage of healing. Your lifestyle should reflect your biology, your movement, and your recovery capacity. To explore these principles further, our patients may benefit from reading my book, Regeneration by Design, a guide to live regeneratively based on science of longevity, personal health, and tissue recovery. We recommend low-impact, strength-focused exercise that support alignment and joint control, cycling, resistance training, and proper form of swimming and Pilates. Avoid repetitive, high-impact routines that overload cartilage. The key is precision, strengthening muscle to absorb shock and support joint without excessive strain. Pain is a signal, not something to ignore. If your joint is sore, swollen, or moving differently, get assessed early. Use technology like motion analysis, bone scans, and MRI. We can identify problems and dysfunction before structural damage occur. Early detection lets us introduce non-surgical regenerative options like biologics and load correction that halt or reverse progressions. Timing is crucial when it comes to joint preservation. Think long-term and structured. Move well, eat for tissue health, and recover fully. Incorporate progressive resistance training, mobility work, and periodic assessments. Prioritize nutrient density, joint-friendly supplements like chondroitin. Consistent sleep routines will also help. Vitamin D is essential, as are other substances such as magnesium, omega-3, and protein intake. But also consider compounds like chondroitin, especially in patients with cartilage stress. It plays a structure and biochemical role in joint fluid and tissue integrity. Additionally, high-dose vitamin C can assist with collagen regeneration and support cellular repair process, particularly around surgical and injectable treatments. Vitamin B12 supports energy metabolism and tissue healing, making it especially useful for those undergo regenerative treatment. Combined with motion profiling, good mechanics, and early interventions, these supports enhance your regenerative potential. Prevention is most effective when biology, chemistry, and movement are aligned over time. My approach follows the regeneration by design principle, blending physics, biomechanics, chemistry, inflammation, biology, tissue health, and time, disease stage. We stratify patients using motion capture, MAI motion, bone scan and MRI, and blood markers. Based on these, I have created a layered strategy from mechanical optimization and regenerative injectable, platelet-rich fibrin, microfragmented fat, to surgical preservation or replacement where necessary. The key is matching treatment to patient's biological stage and movement profile. HA selection must consider more viscosity. I prefer formulation with synthetic synergistic property, such as those combined with chondroitin, for them to enhance viscoelasticity, biomechanical modulation. Chondroitin can influence cartilage metabolism, reduce inflammatory cytokines, and improve joint mechanics when paired with hyaluronic acid. In the right patient and at the right time, this combination offers regenerative support, not just lubrication. The decision aligns with my principle, matching the intervention to the mechanical and the biological profile at the right time. Reassess cartilage integrity via MRI, joint stability with MAI motion, and systemic inflammatory marker with blood tests. If the joint retains regenerative capacity, we can modify the loading patterns. Hyaluronic acid particularly useful in biological active compound when it mixed with chondroitin. It can create a favorable environment for tissue recovery, but timing matters. Too early, there is no need. If it's too late, the tissue doesn't respond. My protocol integrated diagnostic imaging, biochemical data to determine the optimal window for injection. Before treatment, ensure hydration. Avoid NSAID if safe. Reduce joint loading. Consider preparing the body with a short course of oral or intravenous vitamin C, especially in patients undergoing regenerative therapy, to enhance tissue receptibility. Vitamin B12 may also support nerve regeneration and cellular energy metabolism. After treatment, encourage controlled movement. Avoid impact for 72 hours. And when possible, use adjunct therapy like the Regen EMS or photobiomodulation. We follow up with MAI motion to assess movement changes and MRI for structural response. HA is not a standalone fix. It works best as part of integrated regenerative protocol tailored to the individual.